Hey everybody, welcome. We are Proper Health. This is a pre-recorded message, so I'll be skipping the Q&As. What makes Proper Health a better choice? Well, cost, convenience, that's the direct answer, but Proper is so much more. We offer medical freedom, the freedom and resources to use, mainstream medicine as we know it now, or holistic care. Medical liberty, the liberty of owning your own health, being paid up so your costs don't constantly rise as you age. And finally, medical independence, having health care that's not weaponized by our government. During this pandemic, people, they lost their jobs, doctors were ridiculed, their licenses were attacked if they questioned the government protocols. Look, government that handles our social security should not handle our healthcare choices. My goal is to replace what's not working with something better. I'm Charles Falgu, founder of Proper Health, and in the next 25 minutes, my goal is to prove to you that health insurance sucks, although I think that's probably going to be an easy thing to prove. Okay, so the areas that I'm going to discuss are the ACA premiums as they stand now. I'm going to jump right into the proper solutions, benefits, cost comparisons, so you're going to know quickly what proper is all about. And I'll discuss our cause, why the traditional model has failed us. And finally, I make an offer that I believe is going to make your business more profitable. So who do we serve? We serve the small group and the individual market. The large market is required to pay ACA bloated premiums. So small business owners, I believe this is your competitive advantage. If you have insurance or if you don't carry insurance, you're going to find value in this Proper Health approach. So here are the Bexar County community rates as quoted by all the top traditional carriers. And let's just say you're 45, you're looking for a middle of the road plan. It's going to run you $535 a month. Here is what I want you to consider though. If you're lucky enough to live 15 more years, you're looking at $1,000 per month. You have to ask yourself, is your income going to be able to maintain these kind of increases? Do you want to keep sending $1,000 a month up to Chicago or Minnesota or Connecticut for Aetna, to these carriers? And by the way, these numbers here reflect just the managed HMO EPO rates. If you wanted a PPO product, you could add another 15% to that. So what is a silver plan, middle of the road plan going to provide you? It's going to be a $4,000 deductible, $8,700 max out of pocket. It's a managed care plan. So, if you're shelling out $7,000 a year in premium, plus you're shelling out the $8,700, you're roughly at $16,000. Your insurance doesn't pay 100% till you've shelled out $16,000. Again, how many times in a year or in your lifetime incurred over $16,000 in charges? So Proper, we do things a little differently. We unbundle healthcare into three separate categories. Your primary care, that's the little stuff that is clearly what businesses and what people want. They want to be able to see a doctor, get diagnostics, and get prescription medication. Secondary care, of course, falls with your pregnancies, your inpatient, outpatient surgeries, your physical therapy. These are planned expenditures by the most part. And finally, your catastrophic hospital ICUs, transplants. These are, in many cases, career-ending health problems. So let's look and compare the primary care benefits of a traditional model versus Proper. So for doctor, physician, mental health, wellness care, traditional carriers are going to put hurdles. They're going to require you to pay deductibles and co-payments. Insurance companies hate high frequency claims and they make you pay dearly for those benefits. Wellness, that might include managing a thyroid issue, blood pressure issues, sugar in the blood. So the traditional model, they promote a personal visit to your doctor who, by the way, has a financial incentive to upsell you. With Proper, we offer a zero cost virtual visit with your own personal care physician that you choose that do not have a financial incentive to upsell you. And I could talk long about this because this is huge. In fact, what Proper does is that we send smart devices directly to you and your employees' homes. So in the comfort of your own home, you can take your blood pressure and your glucose readings right there. Now, these data points will sync directly with your phone and are sent to your care team so they can monitor your health. This is giving doctors far better information about your overall health than a once a month or once every 2 month snapshot photo when you actually go to their office. Folks, I really believe that these smart devices right here are the future of healthcare, but the traditional models will not embrace it because there's just too much money in controlling the traffic. They want people to go to these offices. Look, as a business owner, who is trying to make sure that your employees show up to work not sick, or if they do get sick, how is best to resolve it quickly so your employees can get back on the job quickly? I believe the Proper health plan is the smartest choice, offering your employees some high deductible health insurance that, one, they can't afford, and two, they don't know how to use it in many cases, just isn't the smartest strategy. Going deeper, blood work, imaging services are almost always called for. Your carriers are going to make you pay the whole thing because it's going to fall under your deductible. So what do employees do? They avoid it. They don't get it done. Proper, we offer a zero-cost blood work and imaging services, and I'm talking MRIs, CAT scans, ultrasounds, mammograms. You present your Proper health card to our partners, and you will have a zero-cost service for that. For prescription medication, insurance companies use expensive formularies. Proper, we use a pure wholesale pass-through. So again, you present your card to your pharmacist and of your choice, and they'll fill that prescription at a wholesale price. We're similar to GoodRx. We beat them on most of the drugs. Pre-authorization, I know, is more of a feature than a benefit, but with Proper, look, there's no asking permission. You don't need to call us. Go get it done. Comparing, again, going deeper into the features, insurance companies, they're going to use these narrow networks that your employees have to use. And I got to tell you, employees struggle to try to find who accepts the plan. In many cases, they'll just go to an out-of-network provider and they'll pay these out-of-network fees, and they're irritated. That's why a lot of people are just dropping coverage. With Proper, your employees, and we're going to teach your employees because they're going to have an app on their phone, and there are thousands of doctors to choose from right there on their phone. And once they select their doctor, they will have access to his or her calendar. They'll always be able to talk to their physician that they want. Your employees will finally, and I got to say, will finally have a true primary care doctor. A lot of people just don't have doctors that they know or trust. If you need a stitch because of a cut, or you need a bone set, look, go to any urgent care center by your house or by where the incident occurred, and if they take cash, they take Proper. And you're going to understand this here more in just a bit. Proper is owned by the employee. This is huge, especially if you can't work 30 hours a week. Proper is paid up, meaning that your costs will go down as you age, not automatically go up as the traditional market. And finally, the admin is minimal. There's no contribution rules, no participation rules, no COBRA, no state continuation, no Medicare secondary payer rules. Again, it's very simple. Cost. Let's get right down to the nitty gritty. With the traditional model, you can't buy just primary care. They have to package it into, either their bronze, silver, or gold plans. And in order to get real primary care, you got to buy gold. And a lot of employees just can't afford that. So with Proper, you pay $150. That's going to resolve 85% of all the care that you're going to need. It's a price point that your employees can actually afford now, which means if they're enrolled, that's going to increase your employee morale. It's going to decrease your absenteeism, and it's going to increase your productivity because you're giving them a zero-cost solution for their primary care. Okay, so secondary care. Like I said earlier, pregnancies, inpatient, outpatient surgeries, physical therapy, the cut that you need a wound, that stitch or set a bone. This is where it falls under. So here's where it gets interesting. Price transparency today is a new law, but insurance companies are not going to participate, not gladly. We know for an absolute fact that people with insurance, they pay higher reimbursement rates. Here are just 4 examples of over 16,000 surgeries that happen every day, and cost is driven by what's called a CPT code. And I'm sorry to get into the weeds here, but this code here, 14350, happens to be a particular hand surgery. So by law, Medicare has to be the lowest payer. So for that particular surgery, they pay the hospital $2,300, they pay the physician $700. So again, $3,000, and it's taken care of. And these numbers are actually provided by Medicare. Now your traditional carriers, and that could be Blue Cross, United, Humana, Aetna, for the exact same surgery, they're going to pay $6,000 to the hospital, $2,000 to the physician, for a total cost of $8,000. Now this info is provided by millions of paid claims by what's called TPA administrators. Again, insurance jargon. So what Proper does is we take the Medicare rate and we add 20% to that. And so we will find a free market facility and a physician that will accept $3,600 in this particular scenario. And believe me, they're out there. If a doctor's willing to do it for $700, he's certainly willing to do it for $850. So the burning question is, would you rather pay $8,000 for a surgery or $3,600? Code 15100. If you have insurance, be prepared to shell out $5,500. If you have Proper, you shell out $2,100. This is just one reason of many that health insurance sucks. You're paying higher premiums, higher deductibles, and higher reimbursement rates. Here is Dr. Hennessy. He's the owner of Prater that provides the numbers that I just shared with you. He was invited to President Trump's price transparency signing law. He's a big player in that space. Okay, so with that kind of explained, instead of insurance, we offer a banking product. Again, let me repeat. Instead of insurance, we offer a banking product that is designed with insurance principles. So our members can take full advantage of cash pricing. A Texas billionaire family that was fed up with how the government took over healthcare with ACA launched this product back in 2018. And here's how it works. Let's say you have an employee, Lucy. She's depositing $250 into her personal health matching account. Over the course of a year, Lucy's put in $3,000. Now, Lucy will earn a $1,950 match. So Lucy will have $4,950 in her bank account ready to spend for any health care problem that might occur. Now, remember, Lucy's primary care was fully taken care of with our direct negotiated contracts that I just discussed on the primary side. So this money is really truly free to grow. I mean, unless you have surgeries every year, or unless you have, pregnancies or something major, these monies really will grow quickly. Year 2, Lucy's going to put the same 250, so she's in for 6, but now she's earned a match of 7,500. So now Lucy will have 13,500 ready to spend in her purse. Now I'm going to tell you, just from also from personal experience, from dealing with people out in the marketplace, Lucy is going to start seeing the light at the end of the tunnel. Lucy now has medical freedom. She's no longer fears a medical expense, a dental expense, a vision expense. I can't tell you how many people are stressed out because they just don't have these deductibles that are offered. You're not going to lose Lucy to a big competitor because they're too busy offering high deductible Obamacare insurance and taxes. And I think Lucy's going to see that you have her best heart, her best interest at heart, and she's going to be loyal to your company. Now, year 3, and it's not even a full year, it's 11 months, Lucy will put in a total of $8,750. She'll earn a match of $16,000, and she'll reach her $25,000 target balance. And I'm going to tell you right now, Lucy enjoys medical liberty. She's no longer a slave to an insurance company. She doesn't have to bite that hook every year. She has solved her health care issues for the long term. So, we at Proper say, look, start owning your health. This whole collective beehive insurance mentality where we all throw money into these trust funds, these insurance trust funds, and we just wait our turn to get sick, it's just not the correct solution today. It worked in the 70s and the 80s, but I got to tell you, the population is far different now. I look at some of the population and say, I want no part of being in some risk pool with that. I'm just not going to do it. And I got to tell you, if you present an insurance card to a doctor or to a facility, just be prepared to pay higher rates. With Proper, you start building your health matching account and you take care of yourself. At the end of the day, that's who you're responsible for. We don't live in a village. Okay. The banking product, of course, is completely flexible. If you only have $100 to spend, then you'll earn a $6,500 match. You'll get to your $10,000, and then you'll move up from there. I personally purchased the $25,000, but it was in my budget. I was saving $700 a month by not buying insurance. But here's my conservative plan. I know that once I get your employee, Johnny, Lucy, whoever, to 10,000, it's so easy to get them to 15 and the 20 and 30 and 40, and you can build up to 60,000. And once you have that kind of money, folks, you have freedom. You're liberated. You're independent. You don't need to rely on some government rule or what have you for your health care. And isn't that really what people work for? They work for ownership, not working to rent insurance for a year. Now, this is a banking product. It's guaranteed matching dollars. You can't lose. It is FDIC insured. Okay, last but not least, the catastrophic care. This is what insurance companies love to promote and scare people. So looking at the benefits, again, they're going to cover you 100% after $16,000. Proper, we have an umbrella policy that, from Partner Re, they're a multi-billion-dollar corporation, and it reads that it pays 100% from $50 to $5 million. Now, we have hospital products and cancer products that were designed specifically for that first 50. But to be quite frank with you, the banking product compounds so quickly that most choose to go that route. Again, that's a personal preference. If you're pregnant now and you know you're going to be in the hospital, we know for a fact that cash payers pay about $12,000 for normal vaginal delivery. It's usually about 18, 19 if you have insurance. So our hospital product pays roughly about 10,000 for pregnancy. You'll still be out of pocket maybe two. Okay, comparing the cost. Again, traditional markets. You can't buy strictly a catastrophic policy. They will not sell it. It has to be part of these metallic categories. With proper, it's an add-on. It's an optional purchase. 99 bucks a month, boom, it's taken care of. Look, if you have assets, protect yourself. If you're a 25-year-old person and you don't have two nickels to squeeze, I'm not necessarily convinced this is your best purchase. My high net worth clients just love this option. So, real quickly, quick summary: with traditional insurance, your premiums are going to constantly rise year after year. You're sending your hard earned money up to the north, and you're building absolutely no value. And I also venture to say no loyalty, because your competitors are offering the same thing. At the end of the 4 years, you've paid $34,000. With proper, look, you're keeping your money right here in Texas. $150 is going directly to the vendors for those primary care contracts. $250 is going to the banking product that's, again, staying here. And then by bundling everything, we cut you a break on the catastrophic, $79. So that's $479. Over the course of a year, that's $5,700. But you remember, Lucy had $5,000 at the end of 1 year, so your net cost is $800, not $8,000. Year two, your account is larger than your actual contribution. Year three, you're going to reach your $25,000 and you're paid up. Now, look, I know that that's perfect scenario. But here's my position. If it takes you 3.5 years to get to 25, or 4 years to get to 25, because maybe you have, a couple $1,000s of expenditures over that course of that time, so what? It's still worth it. It's still worth building your own nest egg. After 3 years, your premium is going to drop, and your employees are going to be thrilled. You are going to be thrilled because you're going to save $14,000 off of the cost, and more importantly, you don't have that constant pressure of increasing your cost because of increased healthcare cost. That's a lot of cost in there. So proper. We cover the care you need. We cover the care you want. We believe in playing offense. I want access to great health, not just defense and fixing poor health. And if you're out there and you're working on your fitness goals of losing weight, maybe you need bariatric surgery. Maybe you need plastic surgery or cosmetic dentistry to make you feel better about yourself. Or maybe you're like me and you just want a more naturopathic approach to healthcare. These are care items that the traditional models won't cover. We do. So our cause is simple and it's controversial, but here it is. The only way you're going to protect your health and wealth is to walk away from traditional government-controlled health insurance. But the only way to walk away from traditional health insurance safely is the proper health approach. I've analyzed the Christian-based sharing programs, the short-term, health plan solutions. None will provide you that long-term approach. So will you join our cause? Will you join over 40,000 Texans just like you who have walked away from the traditional market and have said yes to independence, freedom, liberty? If it's okay with you, I'd like to just spend the next 5 minutes going over 3 slides outlining a very special offer that we've created. It's not on our website or our marketing materials. It's strictly available to those in these presentations. It's real simple. Look, if you join Proper Health in the next 90 days, you will receive absolutely free these 4 bonus offers. Bonus 1 is nutritional services from Healthiest You. They'll provide your employees unlimited access to dietitians and nutritionists. They can create meal plans, design programs for you and your employees to better manage their weight and overall health. That's a $600 per employee benefit, absolutely free. Bonus number 2, which is my absolute favorite, is Best Doctors. You know, when your employees are facing tough medical choices, I got to tell you, local doctors can be quite convincing. It's hard to it's hard to fight with them. You know, let me just put it in layman terms. Don't really. Best Doctors will review your medical records. They will review what your doctor's recommendations are, and they will either put a stamp of approval, yes, your doctor's being true, or hey, here's an alternative choice to consider. You know, according to bestdoctors.com, and don't take my word for it, look yourself, 79% of their reviewed cases have modified treatment plans. You know, I think this is a testimony of the fact that medicine is a business, folks. And unfortunately, you know, if you're a surgeon, you want to do surgery, and that's not necessarily always the best course of action. Bonus number 3 is dermatology services. You know, again, this is usually a specialty care with proper. You take a photo of your skin condition, you send it up to your care team, and you will get a diagnosis within 24 hours and a prescription sent to your pharmacy of choice within 24 hours. Again, this is usually a $600 buy-up option. We're going to throw it in absolutely free for joining us. Bonus number 4 is the proper price shopper. Look, we know San Antonio. We know where the good deals are at. Yes, we have Prater that gives us, you know, a lot of great info, but we know where the free market, you know, surgical centers that can save you a lot of money on common surgeries, you know, and I'm telling you, huge price differences. This is a $2,400 value for each employee, absolutely free, just for giving us a try. And just to give you a quick recap, we and again, everything is separate too. So if all you want is the primary care, but you want to keep your Blue Cross as a catastrophic insurance, fine, do that. That's fine. But I mean, this will give your employees 100, you know, a zero cost primary care solution. I think our banking product is the best financial product in the market today. It provides that freedom, that liberty, that independence that we all want. And finally, the catastrophic policy is at a price point so you can cover your assets. Along with the 4 bonuses, so this package deal is $379. Again, this is where you would have a little bit of, you know, variability on it. I don't think these prices are going to last long because I got to tell you, people are dropping traditional insurance in huge numbers. And the reason why is I think people are a little afraid. I mean, energy costs are going up, you know, food costs are going up, rent's going up, and things are getting squeezed. So in closing, if all we did is that we provided you a means of being independent, you know, we doubled your money, so we kept your money right here in Texas. We empowered you from having to rent from the traditional insurance market. Wouldn't that be worth joining Proper Health? If all Proper did was that we increased your employee morale, we decreased your absenteeism, we increased your productivity by giving your employees a zero-cost primary care solution, wouldn't that be worth joining Proper Health? And finally, if all we did was that we could truly teach your employees how to use these smart devices so they experience better health outcomes, and we could teach your employees how to be better consumers of healthcare, and I can't, this is where it gets real big, because today everybody is doing everything themselves. It's a do-it-yourself deal. You know, here's a link, enroll yourself. Here's this. People need help. They need help understanding healthcare, and that's what Proper is about. And isn't that worth joining a Proper Health right there? So look, all of our products have a 100% money back guarantee. Talk to your agent that sent you this info or this video, or feel free to give our office a call. We would love to have a conversation with you. Thank you very much for joining. Bye-bye.